All right, I am going to get us started. We are so grateful that you're here. I want to start by introducing our interpreter, Lucia, and I'll hand it over to you.
Hola, buenos días. Muchísimas gracias por estar con nosotros. Yo me llamo Lucía, soy su intérprete para la reunión de hoy. Si quieren escuchar la presentación en español, deslicen el icono del globo que está abajo de la pantalla y ahí pueden escuchar todo en tiempo real en español.
All right, thank you so much. Thank you everyone for being here. My name's Jessica Smith. I am the Director of Business Development and Community Engagement here at Jefferson Center. We're so grateful for you taking time out of your day to come hear about our Youth Crisis Stabilization Unit. We're so excited because we restructured the program and the outcomes we're seeing from this restructuring are incredible. Feedback from the children and clients themselves, as well as their family, has been extremely positive. We also revamped the space, have some new paint on the walls, and so we're just really excited for you to hear about how our Youth Crisis Stabilization Unit is functioning from the program staff themselves. So I'll hand it off to Charisse to introduce herself, and thanks again for being here.
Hello, my name is Charisse Frazier. I am the interim program manager. Nice to meet you all.
Hi, my name is Jenna Lowstetter, and I am a psychiatric nurse practitioner on the unit.
And hi, I'm Liz Schuman. I'm the director of the CSU and the chief medical officer at Jefferson Center. I'm a board certified child and adolescent psychiatrist. And like Jess said, we really appreciate you all coming. Just a brief introduction. You all may have heard of a program called New Vistas, and New Vistas merged with Jefferson Center at the end of 2023. And we ended up closing that program down and then completely rebuilding it back up. So we hired new staff, did new clinical policies and procedures, new medical policies and procedures, and completely redesigned the clinical programming and the daily schedule for the kids. So we renamed it just the Youth Crisis Stabilization Unit at Jefferson Center. So New Vistas doesn't exist anymore, but our Youth Crisis Stabilization Unit does. And to start off, we have a video just giving you all a virtual tour.
When you first walk into the
Cuando
CSU
entras al
unit,
centro,
with
a
our
la unidad
day
de
room.
CSU,
This is our day
empezamos con lo que se llama el Day Room,
clients
sala.
spend a lot of the day when they're not in
Aquí muchos
programming.
pacientes pasan el día cuando no están en un programa.
Downtime.
Aquí
There's
pueden
activities
relajarse,
around board games and
tienen
puzzles,
actividades
books,
como
coloring,
juegos de mesa,
comfortable area.
rompecabezas, pueden colorear.
Patients are in between programming that they're
Cuando
doing.
los pacientes están entre programas,
Outdoor
ellos pueden estar.
weather permitting.
Tenemos un patio afuera,
We
el
have
tiempo está lo
outdoor
permite.
space.
Tenemos este espacio al aire libre.
Play sometime outside. There is also an indoor gym.
También tenemos un gimnasio adentro.
Outdoor activities. Our individual therapy room where our therapists
Cuarto de terapia individual,
with clients and
donde se reúnen nuestros terapistas uno a uno con los clientes.
we do have offer an individual session to each client every day.
Tenemos la posibilidad de darles sesiones individuales a los clientes todos los días.
This is our group therapy room.
Aquí está el cuarto de terapia de grupo.
Therapy sessions. There are 4 therapeutic groups per day and a
Hay
month.
4 grupos por día.
We have what we call our Zen room, and
Tenemos un cuarto que llamamos Zen.
offer to clients who might need to take a break, might need some
Y
sensory space on their own.
les
Our nursing area.
pueden quedarse un rato. Aquí está el centro de enfermería.
In this area, and this is where we assess patients on a daily basis
Y
and
evaluamos a los pacientes a diario
medication.
y le administramos su medicamento.
Right now, we're the only youth crisis stabilization unit in Colorado. One question that someone recently asked is what's the difference between a crisis stabilization unit and an inpatient unit? And there is definitely some overlap. We can, for example, take children and youth who are on an M1. We take children and youth who are having suicidal or homicidal thoughts or may have had a recent suicide attempt. One of the big differences is that we cannot keep youth we try to keep it 5 days or under, and we really cannot keep them for more than 7 days per regulation. And another difference is we all youth are receive checks at a maximum interval of 15 minutes, but we can't do like, for example, within arm's length or even continuous eyesight for their whole admission. So if a youth requires more supervision than the 15-minute checks, they're probably not the best candidate for our unit. We do take kids ages 5 up to 18, and they have a variety of diagnoses. But the biggest criteria for admission is that they are unable to currently thrive in the community and need this level of care, and that they're able to benefit from our programming. So, for example, we will take kids who have some neurodiversity or intellectual disability as long as they are able to participate and benefit from our programming. We have a multidisciplinary team. They meet every day in rounds. This team includes nurses, prescribers, therapists, milieu staff, and we also have some admission specialists who quickly review referrals and ask questions as needed, but they're the ones that contact the referral sources back after receiving a referral. Like I said, our average length of stay is about 3 to 5 days. I think we're at about 4.9 days right now. We can take up to 14 youth at a time. We do have 16 beds, but we do have strict requirements as to who can room with who. So we plan on never taking more than 14. One thing that's really important is that we take everyone regardless of their ability to pay or not. We accept Medicaid, private insurance, and self-pay. And if someone is self-pay, we might be able to give them a reduced fee based on if they qualify based on income. And note too that we overlap with inpatient care in terms of what we can serve, and we're more affordable.
So, like Dr. Schumann had mentioned, that we recently restructured our unit. So when we did that, we did have a reduced census as we wanted to make sure that we made changes that met the needs of our families and clients of the communities that we were servicing. So when we did that, we did reduce the age ranges that we were servicing. So when we did that, we were only servicing clients up to ages 10 up to 18. And recently this summer, we did open up to 5 up to 18 years old. We did recently refresh up our paint, as you can see in the video. So that was really cool to do this past week. Our unit is newly structured and it's evidence-based with therapeutic models. We provide 5 daily groups a day. That is based around psychoeducation, DBT, CBT, ACT, and a mindfulness and meditation group. And we based those around 5 core themes. We thought of what core skills do we want our clients and families to walk away from our program. And those core themes are communication, relationships, self-worth, self-regulation, and self-awareness. And if they take anything away from our program, we want them to walk away with some of those foundational skills, in addition to anything they're going to learn from individual and family therapy that is a lot more individualized and tailored to their individual needs. We also do daily reflections and goals group. And in those groups, are going to identify their emotions that they're feeling for the day. How can staff better support them throughout the day? And if they're feeling any suicidal or self-harm urges, so we can better support them. And they're also going to identify a self-defined goal. That way they can have a lot more autonomy over their programming. And so that's really cool to see how they can figure out what do they want to work on while they're in our program. And it's really cool to see the kids start to define and shape how the programming can work for them. We also have a Zen room, as you saw in the video, and that is a more therapeutic space for our clients to take space to regulate. They can use that as long as they need. We have different regulation tools that we provide for them in there, such as yoga mats and different tools that they can use to just calm down and regulate. Something to note that we did change with our restructuring is we don't provide chemical restraints and we don't have a seclusion room here on our unit. We also incorporated quiet and reading time with our newly restructuring, and we did that intentionally as we wanted to provide a space for our clients to work on practicing their skills without distractions. As we know, often that is a time that kids become dysregulated when they go home. They don't always have cell phones, they don't always have TVs to distract them from their thoughts, and we wanted to provide them a space that they can learn to work through that. All of our clients are provided a safety plan when they initially intake onto the unit. So our staff are there to guide and support them through any times that they need. We also do outside and gym time twice a day, depending on the weather. That way they can get their bodies moving, get out some energy and regulate and just have some fun. There is lots of learning that happens on our unit, and we just want them to have fun while they're also here to have a good balance. And then we also have dietitian approved meals here 3 times a day, as well as snack time 4 times a day. And then, like I said, we do safety planning and discharge. That's a huge part of our unit. All clients have safety plans the day they intake onto our unit, and then we are constantly revamping that throughout their stay here as they're learning more skills. That is also collaborative with their family and throughout their time here, throughout family planning, throughout family therapy, and also during the day of discharge as well. And then we also tailor the discharge plan based off of the family and the client needs. Sometimes that's looking at a step down placement, such as a PHP or IOP program. Sometimes that's looking like going back to their current outpatient therapist, or that's switching up their therapy if that current therapist is not working for them. But really trying to tailor it and really trying to adjust what does this client and family best need to support them in their transition back into their community. Our goal is really to stabilize the client and the family and trying to transition the best way possible so that they're more stable in the return to their community. And we are really proud of our evidence that our program has been really successful so far. And we're really excited about these numbers. So 100% of the youth strongly agree that they felt safe and supported by staff. 100% of the parents and guardians agreed that their child was in a safe and healing environment. 90% of youth felt they were being included in their own treatment planning. And 82% of parents and guardians strongly agreed their child's needs were addressed by their team. All of our children and families are provided with a survey discharge where we ask them various questions about how they felt their stay at the crisis center went. And just we're trying to better revamp our program and just see how we can better address their needs. And so we're really prideful of the results of our programming. It sounds like we're doing a really good job, and we just want to continue to improve at the work we're doing. So we're really happy about these numbers.
Okay, so in terms of the referral admission process, the way we do that is through either one of the walk-in crisis centers throughout the state or mobile service providers, as well as emergency departments throughout Colorado. And so the reason that we use these referral sources is just because we need the youth to be assessed to make sure that it's the appropriate level of care for them. We do have a 24-hour admission team that is able to screen referral packets that come in real time. What they'll do is when they get a referral in, they call right away to do an initial pre-screen over the phone. And then once the client is accepted for admission, try to arrange transport as soon as possible. Sometimes that can be by private vehicle with parents or guardians, and then other times might require ambulance transport. And then once the client is admitted to the unit, initially they do meet with a registered nurse who completes a safety check and health screening. And then they do orient with milieu staff to the unit. And then importantly, within 24 hours of the admission, the client does need to have a comprehensive behavioral health assessment, which is done by the clinical staff, and then a psychiatric assessment that is by a psychiatric nurse practitioner, typically myself or one of our psychiatrists. And so kind of based on that assessment information, the treatment plan is created right away, collaboratively working with the family at the beginning of the stay to come up with an appropriate discharge date, an appropriate discharge level of care, and then that treatment plan is reassessed every day. We do also have daily multidisciplinary rounds where we can really adjust the treatment plan individually to the client throughout their stay. Like I say, we do offer medication management in terms of if a client is on current medications that might need adjusted or to initiate psychiatric medications while they're here. We do try to make that somewhat secondary to some of the non-pharmacological treatments and really try to emphasize the therapy and allowing the youth to utilize some of the skills that they're learning through the program to really emphasize the self-efficacy. So the other important thing that we're working on throughout the stay is making sure that when the client leaves, that they have appropriate care back in their community. We try to match the service level that they need to what's available in their area. Again, we do serve youth from across Colorado. So we want to make sure that they are plugged into what they need. And again, we do admit clients regardless of their ability to pay.
So we have been talking to our partners a lot the last couple quarters. And one thing that's become clear is that our partners need a more streamlined way to refer to our programs and to connect with our program staff. We do have a central navigation model here at Jefferson Center that works really well for individuals, but for our partners, we wanted to make it easier for you to connect with us and to refer to us. So we now have a partner portal on our webpage specifically for you all. If you see in the screenshot on the blue bar at the top, it says for partners. That's where you will click. Or if you want to bookmark, we have the URL here, this third bullet, and I will be sending these slides to everyone who attends. jcmh.org/partner portal. In this portal, you'll find a brief description of the program, a referral contact number and email, as well as program staff email addresses. So you can find a direct way to refer and talk to admissions. And you can also find a way, if you have questions, if you want to meet with the staff, you can find a way to connect to them there. It's in its early stages, but we're really glad it's up for you guys and hope it is helpful. And please feel free to share feedback with me if you have ideas or anything. We'll have our email addresses on the next slide. Before we get into questions, I wanted to let you know that the next webinar in the series will be on our withdrawal management program. Those will be happening in the similar format with a 5 p.m., a 9 a.m., and a 12 p.m. The 12 p.m. will have the interpretation in Spanish. So please mark these dates on your calendar. When I send you guys the slides after this webinar, we will include the registration link so you can register. And I want to open it up for questions. There is a Q&A function at the bottom. You can also use the chat. I have one question from the chat already, and just want to note that on this slide, you can see all of our contact information as well as the referral line and email. I'm just going to jump into the first question for the sake of time. We have a question. Does the mobile crisis response need to be a JCMH mobile unit, or can it be the STAR unit through our fire department for referrals and transport?
Yeah, so I'll jump in there. No, definitely can be any of the mobile crisis units throughout the state. We actually get quite a few from kind of more rural communities through their mobile response units. So in terms of the referral, the packet just needs to contain a clinical evaluation, just so that we can make sure that it's the appropriate level of care.
I'm going to hand it over to Mandy, our communications manager, to field other questions. Follow up to the one you just answered, Jenna. Does the person need to be licensed?
No, we're just clarifying that it does not need to be by a licensed clinician as long as the client doesn't need to be put on a hold.
What question was asked about the referral link to be used for any services offered by Jefferson Center? And the answer is yes. You'll find on that page contact information for all of our programs and services. As Jess mentioned, we are working on building it out. But if you do have questions about where to refer, Jess's information is at the top as the director of our business development. She's able to help get you in contact with the right person at our location if you're not seeing it there. And the next question is, when did the youth CSU formally reopen? What happens if clients are out of network and do they have to pay full rates per day?
I can answer that. So, the CSU, we did a soft reopen September 16th, where we accepted up to 4 youth ages 10 up to 18. And then this summer, we expanded our age range in mid-June and then increased our census capacity by one. And so we've been almost a month at our full capacity at 14. And then I think there was another part to that question, Mandy.
So a few
Sorry.
parts to that. What happens if a client is out of network and how does that
Sure.
affect their payment?
So it's really tricky based on our grant funding. If we have to use someone's insurance and we're unable to for example, waive deductibles due to federal and state laws. What we can do is if someone has no insurance, we can work with them. And then we do single case agreements with the private insurance companies, and there's no insurance company we aren't able to do a single case agreement with. So we do that prior to admission.
And then another question, is there a packet to complete for the referral or just an email or call at that phone number?
You just send an email with the clinical information that you have, and we review it and we try and make those admission decisions if it's non-complicated within 20 or 30 minutes.
Great. Lots of good questions. That's all that have come through for now. If you can, Liz, just a little bit real quick too on the admissions is what does it look like when someone refers like through a walk-in center?
So what happens if someone goes to a walk-in center? The walk-in center will have a clinician meet with the youth and likely the family or call the family. They do an assessment to see, does this youth need to go home? Do they need to go to an acute unit, or are they is the CSU a best fit? The CSU is a best fit. They then send that information to us, which we quickly review and then contact the walk-in center to go from there and arrange transportation, etc.
Great.
There's a question in the Q&A, Mandy.
Yes. So it's asking about offering interpretation services in other languages.
I can answer that one. Yes, we have a language line for the phone, and we also have a language line tablet that we can do video and telephone interpretations on the unit. And we have multiple different languages that we can provide interpretations for 24/7 for both guardians and clients on the unit.
Thank you.
Great.
Thank you all for your thoughtful questions. I'm so happy that now you're connected to our care team here at the CSU. Their emails are here if you want to meet with them to talk further or have other questions. The referral information is at the bottom. And again, I will be sending an email out this week to all participants with the slides and the registration for our webinar on the withdrawal management program in September. Thank you so much for being here. We really appreciate it. And thank you to our interpreter, Lucia. Thank you so much.